Tomorrow is National Pharmacist Day, a day to recognize and honor all pharmacists across the nation. Jeffrey Kennicott, Manager of Clinical Pharmacy Services and the Director of the Pharmacy Residency Program at St. Peter's Hospital, joins us live to talk about the role of pharmacists at St. Peter's Health Partners. Good morning, Jeffrey. How are you?
Good morning. Thanks for this opportunity.
Absolutely.
It's a great opportunity to promote how pharmacists integrate with patient care, and I really look forward to it.
Absolutely. You know, the role of pharmacists has really shifted over the years from, kind of the strict dispensary role to being an integrated member of the healthcare team directly involved in patient care. Can you talk a bit about what a pharmacist does and your impact on patient care?
I think all of us think traditionally of a pharmacist as in a white coat, and in that white coat providing medication properly, of course, and really tied deeply to the dispensing connection. Okay, and I hope today to talk a little bit more about that expansion of that mission. Particularly pharmacists, as you probably are aware, are reviewing patient allergies, patient medication histories, looking for drug interactions, changing the doses based on the patient's needs, other drugs that they're taking, maybe other things, and really much more to get to the point. And I'd like to bring a little bit of light onto those things as we conduct our interview today. I will describe the range of pharmacy activities and share some success stories. I'll talk about how pharmacists are integrated into care teams that affect our St. Peter's patients, such as cardiology patients with recent surgeries, patients with pulmonary problems, lots of admissions perhaps because of COPD, all different types of patient interactions with a pharmacist actually probably isn't well recognized out there in the world, but we'll shine some light on that today.
Sure. And as a pharmacist, it's not just, like we said, a pharmacist staying down at the pharmacy and, here in the ground floor. They're out and about on each floor really interacting with patients. Can you tell me about that and some of the different specialties that there are?
If you think of pharmacists' involvement in transition of care, so a patient has to arrive at the hospital. When they arrive in our emergency department, there are two pharmacists that are assigned to our emergency department. Suppose it's an urgent situation with a stroke or potentially to be a stroke. A pharmacist is immediately alerted and part of that team as far as whether medication will be provided, because it has to be provided urgently and accurately, and pharmacists are on board with that. Another aspect might be pharmacists responding to codes and medical emergencies. Our pharmacists in the ED are the point people for that, but we have other pharmacists dispersed through the hospital that will respond to code. And so code blues and other patient emergencies, pharmacists are part of that care team, and I don't know that everybody realizes that. Other ways are where pharmacists are involved and clinically I think make a totally significant contribution is in protocol development, where we use medications by protocol to create safety and to create opportunities where everybody in the medication use loop will not fail. And protocol development and policy development is also a very strong component of where pharmacy interacts with this continuum of care that's provided in the hospital. At a basic level, a patient's medication list can be gathered by a pharmacist, and pharmacists are recognized as actually gathering the best possible medication history for the physician to consider. It's been proven countless times in the literature, and pharmacists are involved there. Pharmacists are involved as the patient experiences their transitions of care through the institution. Perhaps they go from the ED to the ICU to a general medicine floor and then back to their home. Pharmacists are involved in every step of the way. Order verification, yes. Okay. Allergy checking, yes. Drug interaction checking, yes. But I'm not just speaking about that. I'm talking about the team that meets daily in the patient's best interest to determine what are these patients' needs so that they can go home safely, and we have pharmacists involved in those aspects of the patient's care.
Great, and you're also, as we mentioned, the director of the pharmacy residency program here at St. Peter's Hospital. Can you tell us a little bit about that program?
Sure. The residency program is for pharmacists that have recently or may have graduated from pharmacy school in the last couple of years. Residents are licensed pharmacists. It follows the medical model, okay? That you can learn a lot in school, but you have to actually learn how to apply what you've learned in school. Pharmacists, very demanding educationally to acquire a Doctor of Pharmacy degree. All pharmacists graduate with a Doctor of Pharmacy degree now. It is at a minimum a 6-year process, and residency is after that process. We have 4 people that we bring in each year. It's a 12-month program, and we'd like to think that our residents are going to aspire to be the future of pharmacy. It's a great pleasure for me to be involved in the future of pharmacy. It's a bit of a handoff, or a bit of a way for me to give back to the profession that's done so much for me and my family, and for my satisfaction, dealing with patients. So we have about 20 preceptors who are pharmacists on our staff, and that train our residents. Our residents could be viewed as super pharmacists, if you will, at the end of a residency program. They are highly desired for hire into probably any acute care or focused care setting. Some of them go on to second-year residencies, just as they do in the medical model. A more focused surgical residency would be an example for a physician after a general medicine residency. So pharmacy is walking those steps, and St. Peter's Care Health Partners is directly connected to those advances in pharmacy training.
That's great. And what, on a personal level, what do you enjoy most about being a pharmacist?
I think because I'm more well along in my career, I'll answer it from that context. I enjoy making a difference in a patient's outcomes, truly their outcomes. Pharmacy could be looked at as managing the checkbook. Drugs are a huge piece of the budget in a hospital such as this. They cost a lot. Pharmacists have a lot to do with that. If you can provide adequate stewardship, even at that level, like using drugs most efficiently and effectively, that means more for everybody. That keeps the financial viability of the organization and the ability to provide all types of care services also an option. There's that. There are outcomes associated with patients with the residents. I like to think of the residents, as we train these 4 residents each year, as we get to see more patients. More patients get to talk to a pharmacist. They are learning how we provide care. We are modeling that, and they are copying how we are providing that care, and then they are carrying that into the patient's rooms, to the bedside, and to all the various places where pharmacists interact with nurses and physicians. And that's very rewarding for me, because as a director, I get to help people do well in these things. And it's very rewarding for me personally. It fits my personal nature as far as being able to give back and make a difference. Ultimately, all of these things are about having the patient at the center, and I enjoy holding that responsibility and that opportunity.
Great. Thank you so much for joining us live today, Jeffrey Kennecke. We appreciate the effort.
Thank you.